My name is Chacha, the one and only Happy Fairy. You're tuned in to The Rise every single morning from 6 a.m. up until 11. But today is simply special because we are premiering a brand new segment on the show. So my family, they call me the doctor of the house because I sabi everything. I know so much. That is all thanks to Google and thanks to just taking care of my friends. So they say, I have headache. I say, use paracetamol or use grandpa. I feel this way or use antibiotics. I feel like a doctor, but you know what? I don't know everything. I've got one special guest in the studio. I would never forget this show because this is my first guest, the first doctor joining us on Healthline, the brand new show that premieres today. It is Dr. Oladimeji Olufemi. Welcome, doctor. Welcome. It's good to have you here.
I'm pleased to be here.
I'm happy to see a doctor. Fun fact, not fun fact. Confession.
Okay.
I don't remember the last time I saw a doctor eyeball to eyeball.
Wow.
Yeah, I haven't. I mean, the type of topic we're about to have, I shouldn't be saying this, but exactly. I haven't been in a hospital. Okay, in 2023, I was in a hospital just to check if everything was all right with me because I had an accident and everyone was like, the accident was a wreck. Like I was upside down and they wanted to call ambulance. It wasn't in this country, it was in the UK. And I say, hey, I don't get insurance, so don't call ambulance. I'm fine. Before they tell me £3,000. And I went to a hospital just to check, and that was the last time. And I do know that I've heard over time that it's quite important to have a relationship with your doctors, to your hospitals, especially as a growing child that I am. But first of all, let me just say welcome before I start talking. Welcome. Good to have you here.
Thank you. I'm pleased.
I've always wanted to know what life feels like as a doctor.
Oh, thank you for that question. Well, I would say most doctors are calm. Mm-hmm. However, there are some that are very tough. For a doctor, life has been, I would say, very stressful right from medical school. You need to read, you need to know a lot about things because people will ask you different questions. Mm-hmm. It is very, not challenging, but it is a tough time for doctors, especially in Nigeria that we are.
How so?
But when you graduate, at least life is better. But however, it could be better. It could be the best if you're outside the country. And I can say that's why a lot of people are jackpying.
Yeah.
That's the word they say people are jackpying from because you earn more when you're outside the country than when you're in Nigeria, and that's the sad truth. The government needs to do a lot to improve the welfare of doctors in Nigeria, so that people would stop migrating out of Nigeria.
You know what I find crazy is that a lot of times people say, I don't want to use a hospital in Nigeria, I don't want to go to a doctor in Nigeria, I'll go abroad. But when you go abroad, you are dealing with Nigerian doctors.
Exactly.
They've said the Nigerian doctors are one of the best doctors that we have. How proud are you?
Very, very proud. I would say again, very, very proud.
Very proud. Welcome to the show again. They say that prevention is better than cure. I mean, but
very
what
true.
Does prevention really mean in practice?
It's simple. Prevention, like you said, is better than cure. You need to prevent. You need to prevent yourself from what you need to avoid a particular situation is more of prevention. So if you're talking about prevention, in terms of prevention, people in Nigeria, for instance, I would say people are not for prevention. Prevention is a proactive approach. It's aimed at you, at least if you're symptomless, no symptoms, you want to find out if there are problems without even having any symptom at all. You want to be sure you are healthy, you want to be sure you have no issues. And this has been shown to improve the cost, reduce the cost of treatment, improves your life expectancy.
Right.
People don't have, in Nigeria, I think the life expectancy is about 56 years.
Anyway.
Yes, that's what it is. You can't compare it to the US where it's about 77 years. In countries like Hong Kong is about 85 years. So we still have a lot to do in Nigeria. And that is what I would say about Diamed Center. People are trying to views people from going out of the country to do tests. You can do it in your own country.
Right.
You have every access to do all the tests, including your eye checks, your body checks. It is available in Nigeria and it is very easy. So what I would say about prevention is that prevention aims at reducing your cost on your health, because when you try to know what the problem is earlier, the solution is available already to get the treatment, and so you reduce the cost on the long run.
Right.
So I would say prevention is the way to go. Is the way to go for your health, and Nigeria needs to go along with that approach.
I would speak as an average Nigerian. The only time I would walk into a hospital is if I feel there's something wrong with me. I would first do a treatment by myself, which I know is bad. Or I'll call my dad and say, Dad, this is what happening to me. He'll say, okay, take this and take that, which is actually bad. A lot of Nigerians don't think that there's something wrong with them because they look healthy.
Very true.
And I remember there was a time I had lumps in my breast and I didn't even know that there was something wrong. It was just random. I just felt it. I was like, what's this? And then I went to the hospital and they said, oh, you have lumps. The next time I went for a checkup, they said there's a second one. I was arguing with the doctor. I said, what do you mean? Like, I'm due to do the surgery next week. The guy looked at me because I was much younger then. I was very fiery. And he looked at me and said, I'm telling you there's a second one. So we have to operate on both your breasts. And thankfully I did it and I'm here today, very successful.
Thank God.
I mean, if I had checked earlier, I probably would have known. A lot of people haven't checked themselves to know that they have, lumps or whatever. But in your 20s, what would you say are the key tests or screenings that you need to do?
So for people in their 20s, there are a lot of things they need to do. First of all, the blood pressure is very important. Your blood pressure is important.
In your 20s?
Yes, it is very important. In fact, your blood pressure should start from the age of 18.
Really?
Yes.
Every time, when I was much younger, every time I hear blood pressure or BP, it's my mom. I always think it's for the older guys. Okay.
It should be started as early as 18 years of age. You should start doing your blood pressure at least every 2 years. Some sources will even say you should do it every year.
Oh, wow.
And if you even have a family history of high blood pressure, you should do it frequently.
Okay,
not
I
every
need
2
to.
years. So if you have a family history, that your mother, your grandmother, you should check your blood pressure frequently, as early as 18 years, and you should continue doing that. When you're in your 40s, you can start doing yearly or every 6 months. If you are unlucky to be hypertensive, you probably need to do it more frequently.
Oh, wow.
So blood pressure is nothing you shouldn't joke with it. From 18 years, just say, Mom, I want to check my blood pressure. Dad, I want to check my blood pressure. It is normal. It is what you should do, and it's a proactive approach to also prevent you, because there are also things we can tell you, this is what you should be doing just to avoid you having high blood pressure. So it is important to start early and check early. As early as 18, you should check your blood pressure. Also for your blood sugar. People don't check their blood sugar. They don't even know what it is. So as early as 18 to 20, you should start checking your blood sugar. If it's every 2 years, you should start checking your blood sugar. If you have a family history, you should check it more often. Your cholesterol is also important to check. People eat a lot of junk. This is yes, junkies. We have a lot of junkies. They eat pizza, they eat popcorns, they eat sweet candies. You should have your cholesterol checked in their 20s and 30s. I would also say, for people that there's what they call the cervical cancer screening. I'm sure a lot of people have heard of cervical cancer. From the age of 21, if you are not sexually active, it's not expected you start doing it at 21. But if you are sexually active before 21, you should start doing a cervical cancer screening. And it's called a pap smear. Okay. It is a test to just check your cervix to see if you're at risk of having cervical cancer. And it is done every 3 years. So this should be done also.
All right. What about STDs, STIs?
Yes, STIs are very important. That's if, again, you're sexually active.
Okay.
If you're not sexually active, it's not necessary. But if you're sexually active, it is ideal you do it frequently. If it be every 6 months, depending on your age. Now we're having a lot of homosexualism. People have to do it more often because they're at risk of HIV, hepatitis infection. These are things that people need to do more often. Some would have to do it every 3 months, some would have to do it every 6 months.
Right.
HIV, for example, people would say, I did it a year ago, I don't have to do it again. But if you are sexually exposed, and if most likely unprotected sex, it is advisable you repeat it after 3 months, because there's also what they call the window period. You may not be positive now, but in 3 months' time, you can be positive. So it is advisable you do it frequently.
See how my heart is beating. Why my heart did it? So I'm okay. Nothing spoiled. But I mean, it's it's very scary as a doctor because you see a lot of things.
Yes.
What is the craziest thing you've seen in a 20-year-old, someone in their early 20s, that could have been prevented?
So I would say the craziest thing I've seen is a 21-year-old. She had breast cancer.
Oh, that's sad.
Luckily for her, it was caught early. She had to remove that part of the breast, and after a year, she was cancer free. Luckily for her. So that is one of the cases that I've seen in medicine. But it's very uncommon at that age group to have breast cancer. Most breast cancer happens when you're in your 40s or your 50s. So for someone in your 20s to have breast cancer, I was shocked. Like, why?
How? I'm so sorry again. Do you know if the surgery was done in Nigeria?
It was done in Nigeria. It was done in Lagos here.
Oh wow.
Yes.
That's impressive. Some people also say that in your 20s and 30s, you probably need mental health screening.
In fact, I would say that mental health screening is needed before 20s. In fact, most mental health screening are picked up in the teens, in the teenage years. Most teenagers have a problem with their body. They're scared of their body image. They're scared. The way they want to now interact with people is different. So they get depression. They get anxiety issues. So it's even earlier. In less than 20, you should go to a doctor and let the doctor, let them examine your child, and especially in the teen ages, and be sure there's no mental health issues. So 20s, yes, is good. 30s is good to do it differently. So what I would suggest is everybody should check their mental health every year. It's not just about doing it.
Some people feel like there's a stigma around it. They say if you're checking mental health, that means they craze for head or something like that.
Well, that's why we need to educate and advise people and give them information about there's no stigma to this. It is a reality. Your health is not just about your physical well-being. Your mental health is very important.
Right.
So we need to advise people that this is what you should do. There's nothing wrong. And that's why education comes a lot to tell people that don't stigmatize mental people. Mental health doesn't mean you're crazy.
Right.
It could be an emotional problem. It's still a mental health.
True. It could be anxiety. It could be depression.
Yes.
Brand new show, brand new segment. Dr. Oladimeji is here with us. I'm Chacha, the Happy Fairy. We're talking about preventive screenings you need to check by age. So, like they say, prevention is better than cure. So you're moving up and down Lagos. You feel like everything is good. You're a fine boy, fine girl, you're all right. You see that a lot of people just slump, they fall down, and you say, it was there's a popular term, brief illness. They say after a brief illness, not knowing that there was something happening in the past. So today we're talking about what you need to check. We've spoken about those in their 20s and 30s. They said blood pressure, pap smears, STI, STD screenings, skin checks, mental health screenings. Now, in your 40s, Dr. Oladimeji, what should people in their 40s, between 40 and 50, or rather, let's say 40 to 60, what are those preventive screenings they need to check?
Thank you for the question. So, for in your 40s and 50s, tests to do include blood pressure, like I said, blood sugar checks, check your cholesterol. This is where you do your breast scan, where you do what they call a mammogram to prevent you from check for breast cancer.
Right. Also,
you could continue repeating your pap smear for cervical cancer screening. We talked about colon cancer screening, which you have to do a colonoscopy. This is normally done every 10 years if you've done it, but there are also other tests you need to do, like stool tests, to check that you don't have any disease in your large intestine. That's your colon.
Okay. Yes. I was about to ask if it was for men or women,
it's
but everybody has a colon.
Yes. Also, PSA is also a test. It's to check. This is for men.
What's PSA?
It's known as prostate specific antigen, and it is to check or detect if there's a likelihood that you have prostate cancer. This does not go. It also involves you also seeing a doctor. They call them urologists. They need to probably do a rectal examination to examine your prostate. This is done in men. This is always done.
That don't sound right.
You do it every year also. We also have tests like you need to check your lungs. There are some people that are at risk of having lung cancer, but this will involve you doing like a CT scan to check your lungs. Tests also include like doing your skin test, also doing your eye checks.
So what is a skin test?
So a skin test is simple. You come to the hospital, let the doctor examine your body. If there are any abnormalities like swellings, like lumps, like discoloration, they need to check because they could also be a form of cancer.
Oh wow!
It could also be a form of a chronic condition that you don't know, because some condition actually present in the skin, it may not be in the body.
True.
And then we give you a true picture of what is happening in the body.
Oh wow!
So that's why it's very important to do a skin test.
Look at my fine skin.
That's right.
So colon cancer starts at, they say, 45.
Very well, very 45. But if you have a family history of colon cancer, you have to do it earlier. In fact, it is said that if you have a relative that died earlier, for instance, if you have a relative dying at 40, or I was diagnosed at 40, then you should begin your screening 10 years before that age.
Oh, yeah.
Yes.
So let's talk about bone density scan.
Yes.
What is that?
So this is it's now because of your aging, the bone at risk of fracture. That means they can break down easily. And so you need to do a bone density to see your risk, if your bones are at risk of breaking, or if you are likely going to have a fracture because of your diseased bone. So this is the test normally done at the age of from 65 years. They do it for people elderly. People that are also postmenopausal also at risk of bone breaking. So they need to do all those tests like bone density scan.
Oh wow!
So it's very important to do it from the age of 65 because you know that they're postmenopausal. They're not seeing their menses anymore. They have risk of having a brittle bone. Yes, that's
like
the word.
biscuit bone.
Kind of. That's the
yeah,
word to
yeah,
use.
yeah,
That's
yeah.
the word to use.
I mean, I like to use layman terms because of the way my brain works. Now, I've seen that a lot of times people in their 50s and 60s, we hear a lot about heart disease.
Yes.
So is there something that needs to be checked?
So for that's why I said in your 20s you start checking your blood pressure. You should start checking.
So blood pressure has to do with heart disease.
Yes, blood pressure, your blood sugar, your cholesterol level. They all have an impact on your heart, on having a heart disease. Also, people that have a family history of heart problems, also you're at risk of having a heart disease. So you should check your body frequently.
Okay, you know what? My brain just did a light bulb moment because we spoke about the 20s. So the first thing you said that needs to be checked in your 20s is blood pressure.
Yes.
So if you fix that, you most likely would be at an advantage.
Exactly. It reduces your risk of having a heart.
Now the right word be that.
Yes.
Reduces your risk of having heart disease.
Yes.
You see, yeah. You see, I told you I was a doctor. You see, doctor in my past life. But don't come to my clinic. If you come with eye problem, go with fractured knee. But yes, so aside that, some people still speak about immunizations.
Yes.
Are these necessary in your 60s, your 50s?
Yes, they are. There are some. We have the flu vaccines, pneumococcal vaccine, because people that are elderly, their immune system is a little bit low, is depressed, and they need something to prevent them from having infection. So it is very necessary if you can get it. If you can't get it, the most important thing is to live healthy, eat well, exercise, and you're sure you're likely to have a very good life. Sorry,
I want to take you back to this flu vaccine.
Yes.
Is it like just taking a shot to prevent you from having cold?
Not cold necessarily, but there's it's called it's a pneumococcal vaccine, because this vaccine prevents you from having a bacterial infection that causes pneumonia.
Okay.
So you take the vaccine to prevent.
Okay. Wow.
Prevention starts from your childhood. That's why when you were born, they give you some injection. They tell you that you should come for vaccination at a particular age, at 6 months, at 10 months. This is all part of prevention.
Right.
And so this is very important for everyone to do.
When we talk about immunization from birth, a lot of times I always look at people's arm. There's always that mark. I don't get the mark. I don't have the mark on my body, so I don't know if I was. But I've been living a healthy life, so I think my parents must have done that.
You should tell the doctor to examine you
to check.
Be sure.
What
you may probably have maybe give you on the right hand. Did you check your right hand?
I don't check my body now. I don't look at my whole body.
So you check that.
So there's one thing again that happens to people I don't know if it happens in 50s or 60s when the elderly, which is memory loss. Is there anything that you can check to prevent you from having memory loss and confusion in your older age?
So for memory loss, there are things that have been shown to reduce the risk of having memory loss at an older age. This includes your lifestyle, your diet, your activity.
Right.
I know a lot of people retire and they get not to do anything at home again. They just sit down and watch TV. They don't tax their brain. This has all been shown to reduce memory loss if you don't tax your brain. So
is it?
Yes, people need to tax their brain so that they have a reduced risk of having memory loss.
So
memory loss is something we cannot avoid as you grow older.
We cannot just retire and just chill, just be.
You can chill, but just have something you're doing every day. And stay healthy, exercise, eat well, eat good food, not just eat well, balanced diets, right proportion, so that you can live a healthy life.
We've been arguing I personally have been arguing with my dad. I'm like, you have retired. In fact, you're not doing your business. You've sold this business. You started another business. You left it. Your children, except me, all of them, my brother, my sister, they get money. They're okay. I'm the upcomer. I'm like, you people are doing well. Like, you're not suffering. Why do you always have to work? Like, now my dad he has traveled to the village. He's doing something for Abia State government. And I'm like, why are you doing these things? He said, I need to be active. So, my Baba, you sharp. Papa, you sharp. If you're just tuning in, Dr. Oladimeji is here, and we're talking about preventive screenings. We've talked about people in the 20s, 30s, 40s, 50s. Now, if you're in your 70s and above, or you have a pa or ma in the 70s and above, you need to do a couple of things. Doctor, please, what are the preventive screenings you would advise someone in their 70s and above to check?
Thank you. So, in the 70s, you would still continue with the screening you've been doing in your 40s and your 50s. Your blood pressure, your cholesterol check, your blood sugar. Also, you need to also check the colonoscopy you'll be doing, which is almost done every 10 years. You should continue that out to about 80 years of age. Very important. That is very important. It's called the abdominal scan to check for abdominal aneurysm of the aorta. That's abdominal aortic aneurysm. So this is a very important that everybody should do at the age of 70 and above. From 65 years, you can do the AAA. They call it the abdominal aortic aneurysm because anything can happen. Aorta is a big vessel in the abdomen and it can rupture. And if it ruptures, the person can bleed to death as quick as possible. So it's good to identify if your aorta, which is the big vessel, is swollen abnormally because there's a risk of it being ruptured. So you need to check it as early as 70.
What about, is this common in Nigeria, dementia? I know that I've watched a lot of foreign movies.
Yes.
I'm watching on Netflix. I hear, my mom, my dad has dementia. Is this very common in Nigeria? Do you think people need to check? Is there preventive screening for it?
Yes, there is. There are questionnaires people ask that you can, when you visit the elder class, the questionnaires you can ask you to grade your level if you are likely at risk of dementia. You see a doctor would have some questionnaires that will ask you questions and be able to know this person is probably at risk of having dementia. So a mental health screening is what we call it, to check, not mental health per se, but to check your dementia. If you're at risk, you ask some questions, they'll ask you some your activities in the house. There are a lot of things they'll ask. There are a lot of questions to ask around it to be sure you're really at risk of having dementia. It is very, very common in Nigeria. Dementia is a scourge everywhere, and once you're elderly above 60, you're at risk of having dementia. There's nothing to do about that.
Okay, so for people who are not very open to speaking, how would you say people need to approach their doctor to ask them about screenings or whatnot? Do we just say I want to do this, or are there things that we tell the doctors for him to determine
so
what to do?
The easiest thing is to come to the hospital. The doctor would recommend the test you should do at a certain age for you. So it's easy. You can come to the hospital. You can come to my hospital. Diamed Center. You just come there. We'll tell you you came to do your check. We'll tell you the test you should do and which is beneficial for you to do. All
right. So how often would you say healthy adults should see doctors?
At least every year. You should see a doctor.
At least once every year.
Once every year. Okay. If you have a chronic condition, maybe every 6 months.
Okay.
And it also depends on your condition. Some may be earlier, maybe 3 months or 6 months, depending on what you have.
My condition is richness. It's wellness. So real quick, this is a final question for me before we get into some of the questions we've gotten. What are these silent conditions people often miss?
Hypertension is one of them.
Hypertension.
High blood pressure is one of them. In fact, it's called a silent killer because you will never know that your blood pressure is high.
Oh wow.
Yes, you may never know. No symptom at all.
Really?
Yes, and you just come to the hospital. I just came to check myself. Or you even come for another thing else. You come either for maybe you can't see well. And by the time you check your blood pressure, it's on the 200s.
Oh wow! Is blood pressure just for people who think too much?
No, it's not. It's not for blood people who think. It's for everyone. Everybody should check their blood pressure. If you have a family history of blood pressure, you're at risk of having high blood pressure. So you should check your blood pressure as frequently as possible. Okay. In fact, I recommend people to have their blood pressure monitor.
I think I got one as a gift.
Yes, and if you're not sure of what value or what should be the norm, just get to see your doctor and doctor will tell you this is what you should be.
As soon as I enter, there's something I usually do when I get home. As soon as I enter my house today, first thing I would do is to check my blood pressure. Because I do have one at home. I got it in December as a gift, and I have never used it.
The best time to do it is when you're just waking up, when you're not active. It's not anything stressful.
Are you gonna tell me that to anyone who tells me my blood pressure is high, I'm overthinking, I should tell the person to shut up?
Yes, that's the word. You should go to the hospital, let them check him, because you don't just make blood pressure at a point.
Mm-hmm.
You need to check it multiple times to be sure this person really has high blood pressure.
Okay.
Or hypertension.
All right. So we have a message from Vivian. She said, is sleep important for Gen Z's mental and physical health?
Very, very important.
They don't
very
like
important.
to sleep.
At least you should sleep at least 7 hours to 9 hours in a day.
9 hours. People they sleep for 9 hours.
Yes, people should sleep if it's possible.
Wow.
7 hours minimum at least.
Okay. Another one from Edwin. It says, what are some healthy coping strategies for stress and pressure?
So one of the very important thing you should do is exercise. Exercise is one important thing you should do that would help. It would release the happy hormones in your blood when you do it.
The dopamine.
Yes, the endorphins, it will release it. Sex is one also. Meeting people is also another thing. Have fun activities with your friends, with your family members. Don't stay alone. Interact with your family members, interact with your workers your co-workers at work. These are things that would help. And also, if it's also time, there are also things like yoga. There are things like mindful therapy. You could even talk to someone just to help yourself.
Right. I like this doctor. I found my doctor because some kind of things when you talk. Tomorrow I'll say, the doctor told me that this is important for a healthy life. Final question that we're going to take. We don't have time for more questions. Apologies. It says, how can Gen Zs manage anxiety and depression in a digital age? Come on. Gen Z, we love you. We love you.
So I think the answer to that is you should visit your doctor.
Okay.
You should visit your doctor, and your doctor would probably see if you are at risk of having anxiety issues or you have anxiety issues. That's how I would answer that question. But things like I said earlier, to cope with anxiety issues, you don't. And before, people didn't used to spend hours on the screen. People spend a lot of hours on their phones, on Instagram, on Facebook. This is not been shown to help. Find time to interact with people, talk to people one-on-one, not with your phones.
Right.
These are all things that lead to anxiety and a lot of depression in Gen Z.
Wow. Thank you so much, Dr. Oladimeji. I don't want to take up too much of your time. I do appreciate you being my first guest. I will never forget my new doctor. Anything do me, doctor, my eyes bending me, I'm about to fly. I'm coming straight to you. In any case, for people who do not have your phone number, I have his number, thank God. How can they get across to you? How can they find you?
I work at Diamond Center. It's easy.
Okay.
The call line is there. It's just to call. Diamond Center is located at TF Kuboye Street around Oniru. You could always give a shout out if you check online. It's available. Call and say you want to see Dr. Oladimeji. I'm available at any time.
All right. Thank you so much, Doctor. I appreciate you. Do you have any final health care tip that you want to give or anything else?
Well, like you said, prevention is better than cure. So
All
it's very important to be very proactive about our health. We should go to the hospital. Even when we don't have any symptoms, we should visit the hospital to check yourself and be sure you are up to date and you're 100% healthy.
Perfect. Thank you so much. I do appreciate.
Thank you for having me.
This is Base 101.1 FM Lagos. My name is Chacha. I've learned some things today and I hope that you have as well. On next Thursday again, we'll have another doctor. I'm excited. I wish Dr. Oladimeji will come back because my doctorate degree is increasing.